Yeah, so I'm Dr. Chris Boyson. I'm director of GMC Appraisals.com. By background, I'm a GP based in the Midlands, and developed a portfolio career over the last few years. I've been an appraiser for the NHS for several years, as well as several different organisations, and more recently set up my own independent appraisal company. Um, but yeah, by background, I'm a GP, a GP trainer, and also my interest is in medical education. So I'm a training program director for the School of General Practice. I'm also a locum champion for the regional training hub, and I'm also an examiner for the PLAB exams with the GMC and also with the Royal College of General Practice. CPD requirements for appraisal. Really, the main thing is it's quite contextual and it should be unique to that doctor and unique to that doctor's scope of work. Um, it's there to act as a kind of conduit for learning. And there's a couple of things really to factor in terms of CPD for appraisal requirements. One is that it should be UK aligned, or the vast majority of it should be UK aligned. And what do I mean by UK aligned? Well, it really should be from UK providers and it should be tailorized to kind of UK guidelines. So when we're thinking about clinical topics, we're obviously considering NICE guidelines, CKS guidelines, and then of course CPD can be clinical, but also non-clinical or professional skills based. And as I say, yeah, UK aligned, UK providers. So that's one feature, important feature of CPD. The other would be the amounts. Now, sometimes with CPD, in terms of GMC appraisal requirements, the figure of 50 CPD credits gets banded around in terms of 50 CPD hours per year. That's a slight misnomer. The GMC don't actually dictate the amount of credits that are required on an annual basis, as it is rather contextual to that doctor's scope of work, or perhaps that doctor actually isn't practicing currently. Um, what is more important, I think, is that it's relevant to that doctor's scope of work. It identifies any areas of need. It is relevant to perhaps their personal development plan, and we're using high quality CPD that is aligned to UK requirements. So I think when we think about CPD, we often think of about clinical knowledge and clinical skills, but actually CPD allows us to develop those professional skills as well. Those professional skills are really important for us as a doctor, because they really set us up for a lifelong journey of learning. So what do I mean by professional skills? Well, some of those professional skills can be developing your communication skills, your ability to teamwork and perhaps lead. So, management skills, leadership skills, um, as well as teaching as well. We know that some of the competencies and the domains that the GMC talk about include those professional attributes like the ability to teach and the ability to be a leader. So I think those professional skills are really important, and just as important as learning about the latest management of stroke patients, for example. So certainly communication skills is an important one. We know that most patient complaints and indeed colleague complaints actually are often down to issues of communication. So, communication skills highly important, but also some of the professional skills can develop your CV, make you more employable. Yeah, I think CPD is a really good opportunity to develop both those clinical skills and those professional skills. So I'm acutely aware that employment is a big issue at the moment in terms of particularly our IMG cohort that are have qualified abroad and are really trying to get their first job in the UK as a doctor. So I think some of the IMGs that I've spoken to, are in their hundredth or so application of, trying to get a job in the UK, their first UK doctor job. And sometimes some of the feedback they get is, that their clinical skills and knowledge appear sound. But sometimes there is a lack of evidence of some of those professional skills. So, for example, advanced communication, evidence of leadership or management, ability to teamwork. And I think there are a few tips that I could recommend those doctors. Obviously, uh, it's tailorized, it's unique to each doctor. But in terms of thinking about how you look at your CV and how you improve your CV, one of the ways in which you might be able to improve your your CV might be through CPD. Thinking about those professional skills, which are sometimes overlooked. So I think CPD allows a doctor to develop some of those professional skills, which hopefully will improve their employability.